Here at Austin Eye, we work as an eye care team of ophthalmologists and optometrists. The ophthalmologists are more surgically focused on surgical vision correction. The optometrists help us with everything else surrounding care of your eyes. So let me introduce you to our two medical optometrists, Dr. Katherine Elkins and Dr. Ashley Deese.
So I'm Katherine Elkins. I'm originally from Madison, Wisconsin. I eventually kind of traveled through the states, went down to Nashville for a while, Boston, Chicago, and I've landed in Austin here with my husband. Relocated in summer of 2023, where I was able to join this team of wonderful people here at Austin Eye, and glad to be here.
We're so glad to have you. I couldn't have asked for a better partner to help me along the way. And I'm Ashley. I am from St. Louis. I am a Missouri girl, born and raised. I did all my training in Missouri and then decided to sort of branch out and grow my wings and found myself in Austin, and my whole family relocated at the same time as me. And so we've kind of called this our new home, and I joined back in August of 2021.
This is a super important relationship that we have because as our practice has grown over the years, the ophthalmologists within our practice have had to devote more and more time caring for the patients who are seeking surgical vision correction. And because we're spending more of our time seeing the patients before their surgery, performing surgery, and managing patients who may need special care after surgery, we rely heavily on Dr. Elkins and Dr. Deese to help us with the aftercare of our patients that we have treated for their surgery.
I think another important thing for our patients to know is that we are always in constant communication. And so if there is a surgical patient who I'm unsure of what Dr. Wong would want, or if there is a walk-in that has something crazy going on, we have them at our side to kind of come in, see the patient if we need to, and we're just constantly communicating so that everyone gets the best possible care.
And we have a very cohesive relationship, and I rely heavily on them. So for patients who Dr. Odette or Dr. Medert or myself have performed the surgery on, and we refer you after surgery to Dr. Elkins or Dr. Deese, we totally trust their judgment on caring for you after your surgery. When a lot of patients contact our office, because I've been around a long time and Dr. Odette has been around a long time, and though Dr. Medert is new to our practice, they're looking to see an ophthalmologist for their eye care needs, which is totally reasonable. But the way our practice has evolved is we have found that having medical optometrists do the vast majority of the general well eye care and medical eye care actually works more synergistically, and it allows the ophthalmologists, the eye surgeons, to be more surgically focused so we can advance surgical vision correction in the best way possible.
I think there can be a lack of education on the difference between the two, and so it can be very easy to assume that you need to see an ophthalmologist to get good care. But we have gone to school for 4 extra years, and all we did was talk about eyes for 4 years straight, and we took 3 rounds of boards, and we have really learned clinically everything that we need to know to be as good and knowledgeable as the surgeons. We just won't be the ones performing the surgery on that day, but we're always working hand in hand to make sure that we are providing the level of care that everyone deserves and needs.
In our role as a medical optometrist here, we're well versed in a multitude of different glaucoma conditions. We are glaucoma trained and certified. We're able to offer specialty contact lenses. We're able to offer urgent care. We're able to prescribe drops, oral medications, the like.
There are a lot of common conditions that our patients have that our two optometrists help care for. Let me just enumerate a few of them: dry eye, macular degeneration, blepharitis, flashes, floaters, red eyes, eyelid conditions, post-op care for your eyes. Even though you've already had cataract surgery or LASIK surgery, they're totally capable of evaluating your eyes and giving you the appropriate recommendation. we love having the two of you on our team. And how do you feel about working here at Austin Eye?
I personally love it. I always say this is my dream job. I have had a couple jobs before here. They were all within ophthalmology, and so I kind of got a feel for how other places work, and then coming here was kind of a breath of fresh air. We are, even down to the techs in the front desk, we're all very close. We all sit in one room and there's music going, and it's very collaborative and carefree while also still getting the work done that we need to. And the ophthalmologists I've become very close with and feel like I could go to them with absolutely anything and they would have my back. And knowing that you enjoy where you're going to work every day is a good feeling, makes you want to come more.
Yeah, I had a previous experience at other hospital settings with other optometry groups, and I have to say this group is absolutely superb. They really do a good job making everyone feel welcome. We do team building events, we go play Jeopardy. It's a great collaborative environment, and everyone gets along super well, from front desk to technician staff to optometry to doctor to the concierge team. So they've done a wonderful job with this organization. Proud to be here.
So we look forward to seeing you in our practice, and we look forward to having you meet Dr. Elkins and Dr. Deese.